All right. So as a frontline healthcare worker, a first responder, you've got plenty of experience in that. What are some of the signs and the things I'm looking out for to recognise whether somebody is having a mental health episode, and then how do we respond to that?
Oh, I think firstly, some will be very, very obvious, that they are detached from reality, that they're seeing things that aren't there or hearing things that aren't there. That's in the most extreme case. So someone who is having a psychotic episode will be really detached from reality. The newest thinking on that, or it's not that new, but is don't argue with delusions, because you can say that's not real, there are not dragons across the road. But that doesn't matter. If they're real to that person, then it's a much better approach to say, why don't we go over here then, away from the dragon? You're not going to, reinforce their delusions necessarily, because they don't need reinforcing. To them, that is really, really real. But if you need them to come with you or to accept treatment, then that sort of approach where you accept them exactly as they are in that moment, even if you logically know that where they are is not a healthy place, and you get that really quickly reinforced in places like the chill out zone, because you are dealing with people who are alcohol and drug affected. So their reality is already distorted. They may be with 4 of the most fantastic, supportive friends that you've ever seen, but they absolutely hate them at this point in time and know that you never do anything for me. So that's the reality that you have to deal with. If that's the person that you want to assist in some way, then you kind of have to log into their reality to make that connection with them. Certainly if we're talking about suicidal.
That sounded like perfect parenting advice as well. The monster's in the cupboard. I'm just going, I should just, go along with it.
Yeah. Because they believe that.
Yeah.
Or you could go along, yes, there were, but I got rid of them.
Yes.
Because I'm your dad.
Right.
And I can beat anything. Yeah. Monster spray.
So thank you.
There's a take-home piece of advice for everyone. And that's really important. Obviously, people who are suicidal are significantly at risk. And if we're, talking to someone, probably for first responders, we've got there because they have said something to somebody or made preparatory behaviours to harm themselves. But if it's just, you're not quite sure, you can listen for clues. What are you doing tomorrow? And if they don't have any plans for tomorrow, that's probably not a good indicator. If they say things like, I don't want to be here, I don't want to wake up, that's not active suicidality, but it is passive suicidality. I don't want to be here. And as we were saying before, really important to ask concrete questions. Have you thought about harming yourself? Is this something that you would do? How can I help you so that you are safe? The most important thing to me is that you are safe. Who can I call for you? If you have an access, if you're working as a health responder, please come with me. We can go to the hospital where we're able to assist you in getting some assistance, because I'm sure that you are really valuable to the people who care about you. And be prepared for people to argue with you. No, I'm not. No, I'm not. Everybody hates me. I'm sure that's not true. Who do you live with? When did you last talk to them? And you can tease out clues that prove to them that there are people that care about them.
Yeah.
Suicidality is the biggest risk, that if we don't pay attention to those sorts of clues and never be afraid in any situation, whether it's a personal one, a professional one, especially if it's yours. Listen to those clues and make sure that person does seek support.